Hi, I'm Dove Sinclair with the Power of the Patient Project. My guest today is Hallie Tiburzi. Hallie is a student of Wagner College studying on the pre-med track, and she is also part of her school's Division I women's fencing team. Outside of school, Hallie works at Staten Island University Hospital, where she is a medical scribe, and today we will be discussing that very important position. So welcome, Hallie.
Thank you. I'm happy to be here.
So can you first explain to us what a medical scribe is and kind of what you do?
Yeah, absolutely. So medical scribes typically work either at an outpatient office, so like your primary care provider or something like that. But I work in the emergency department, which is another typical region for scribes to be located. But basically, the purpose of a scribe is to document all of the patient information, at that moment, so as a patient comes into the emergency department or whether it comes into the office, the clinic, whatever it is. So on a typical day for me, so, I'll go into my job, I'll get the computer, I work on a laptop because I need to be able to move between patient rooms, following doctors, PAs, whatever it is. And so I will, sign up on the laptop, get onto the computer program system. Every location has a different system that they utilize. We use Sunrise at Staten Island University, but it is subject to change. It's not, affecting my, workflow or anything like that. It's just the system that we use. And I will, we'll get started. So I will go with a PA, so a physician assistant or an attending doctor. These are the two people that are allowed to use scribes, at least at where I work and in most of the clinics and private offices that I've heard of. Although I know there are a few places where resident doctors can use scribes as well, or PA fellows. Mm-hmm. So I will go with the doctor or the PA and will move around to different patient rooms, gathering patient information. So basically what the chart consists of is the HPI or the history of present illness, the ROS or the review of symptoms, the PE or the physical exam, and then the plan of care. And all of that will be gathered by myself and the healthcare provider that I'm with, and it'll be put into a nice concise note and put into the system.
Wow, that sounds so interesting. It's so great.
Yeah, I really love it.
Yeah. So did you need any special education or training for this position?
Typically, scribes do have to go through an application process, and I did go through an interview process and a training period, but I was lucky enough that I didn't have to go through. Scribe America is typically the program that people will utilize in order to become a scribe, and that requires, I believe, an entry like exam or something to assess how well you're going to be able to function under those conditions. Like, because to be honest, it can be pretty intense. I mean, I don't know how it is from an outpatient perspective at offices and at primary care offices and such, but like in the ED, it can get pretty hectic and you need to be on your toes all the time. So a training period is definitely required. I probably wouldn't have been as successful from the start of my job to now if I did not have a training period, just because, you're working with, at least for me, I'm working with different doctors and different PAs every single day. And each one of those providers has a different style, has, a different way that they go about not only writing their notes, but how they input them into the system. And you have to remember what each person does. So going through that first, I've been a scribe for almost 2 years now, but the training period for me was a month and a half, I believe, where I was working with a scribe that had already been in the ED for a while. And she just basically showed me the ropes, and every day, feels like, you're learning, every day you're training, but definitely a training period and normally a test, but I did not have to take the exam.
Yeah, great. Cool. And now, as you know, confidentiality is a major thing for most patients. So what are the reactions that you get from patients as you walk into the room with a doctor or a PA? Are they okay with you being there, or do they sometimes ask you to leave because they don't know why you're there?
That's actually a really good question. And it's not something I considered because I don't really run into that issue as often as I would think, I do think about it sometimes in terms of, because, things aren't always as, easy going and whatnot. And there are issues that patients have that are very private and complicated, whether it's situational or whether it is the symptoms that they're presenting. So because it's not all, black and white, super easy, that definitely could be a problem. And I personally have not run into situations where there's been a patient who has not wanted me there or been, you know, whether they're aggressive or confused or, upset about my presence in the room. And I mean, like I said, I've seen lots and lots of different things in which you would expect a patient to respond
Yeah.
that way. Like,
Mhm.
oh, well, you're not a healthcare provider. You're not this. I've really never had any of those types of encounters, because I think that a lot of the times, even in vulnerable and maybe not completely stable patients, they do for the most part understand that their care is confidential. And I try to express that as many ways as possible. Like, even when I see someone that I know in the ED, I try to express to them as best as I can, everything that happens between us in this room, like, you don't know me, I don't know you, nothing can leave here. And that's a major part of my job and a part of anyone in healthcare. Like, you really can't disclose any of that information to anybody. So definitely a factor, but I have not run into any issues about that.
Yeah, well, that's probably a good thing then.
Yeah,
You're
absolutely.
pretty vital to doctors and PAs, I feel like.
Yeah, definitely.
Yeah. So in your opinion, how is being a medical scribe enhancing the patient experience?
I think that it can be confusing when you first hear, you're like, oh, what are you, just like a secretary or anything like that?
Yeah.
And it it's a little bit more than that, I will say, just because when a doctor or a PA is working on their own and they don't have a scribe with them, they have to go see the patient, come up with, a plan of care, and then do it all over again for multiple patients on a busy day, or even if it's not busy, but you have to remember what that patient was. If you've seen 30 patients in a day, you might not remember your first patient. And so that, most, if not all, I mean, everybody that I work with honestly is really great about this, and they don't need me per se because they are so amazing on their own. But my being there really, I would say that it affects patient care in the fact that it's expedited, and it's a little bit more organized. So whereas instead of them waiting until the end of the day to do their note, or waiting until 3 patients later to do the note, that patient's note is put in almost immediately. And so it does depend on the scribe. Definitely, as I've been working longer, my speed in getting notes in, and the quality of my notes has significantly improved. But I think that if I was not there, there's more of a potential for something to either be input not necessarily incorrectly, because obviously, the doctors and the PAs know what they're doing, but that it might be, there might be a few things that are missed or whatever, just natural human error. So I think that my being there definitely does expedite patient care, as well as, potentially improve the quality of the note that is being put in, just because of like natural human error and people being busy and things like that.
Right. Yeah. You're definitely allowing the doctor to have more one-on-one care with the patient too. So
Yeah,
that's
exactly. Like,
great.
they can stay in the room for longer and not have to worry about, oh my God, I'm gonna have to remember all of this to put it in the note later. Like, I sit in there and I listen actively to the conversation that's being had, and I type essentially everything that's happening. And then, important factors are what is emphasized within the note. But all of the, what exactly the patient is complaining of, what is found on physical exams that will eventually end up leading to appropriate care or like management of, whatever it is that the patient is presenting with. I
Mhm.
think that that's all super important to be done almost immediately, and to be accessed then in a, concise and quickly by other people that are functioning in the patient's care.
Yeah, no, definitely. Definitely. And now lastly, how is being a medical scribe preparing you as a pre-med student?
Well, I love my job. Like, I have like a super weird obsession with it, because I love medicine so much, and I love learning about it, that being there. And so I'm a bio major, right? So I'm not even though I'm on a pre-med track, like, I'm not taking anatomy and, all of these anatomy, physiology, pathology classes yet, because that's my job in medical school, right? So that's what I'll take there. And that's completely normal, for pre-med students to not necessarily have that medical background going into med school. but because I'm so passionate about it, I want to know it all now, and I want to, learn as much of it as I can as early as I can, so I'm prepared to go to medical school. And this is why, pre-med students, it's so popular. You see them as medical scribes because every single day you're absorbing knowledge. Both my parents are in medicine, and before I became a scribe, I did know a few things. My dad's in orthopedics, my mom did neurosurgery, plastic surgery. Like, they definitely have a very vast knowledge of things, and just by diffusion, you hear them speaking at dinner, and you pick up on things and you learn things. And so that definitely helped me going into my job. But
Mhm.
my knowledge, the rate at which I was learning things about medicine and about anatomy and stuff, increased exponentially from when I started working in the hospital. And I
Yeah.
can have conversations with my roommate. She's a senior PA student, and on the track that they do at Wagner, you're going to be a PA in a year. And I can have conversations with her about medicine at almost her level,
Mhm.
without having taken all of that stuff. Of course she knows more than me. She's been taking it for 4 years, but the fact that I can communicate with her, or that I can communicate with my parents, that I can communicate with the doctors and the PAs that I'm working with, and understand what is going on, to some degree, is really, really important. And it's definitely, definitely going to help me when I get to medical school and beyond, because I'm going to remember all of the things that I saw every day, like the fact that I know, the signs and symptoms of a kidney stone as a 20-year-old without any, having taken any medical courses, or even things that are a little bit more intense. The fact that I can see that and make like even a basic assessment, I think, is pretty important and crucial for the future of, my career in medicine.
Yeah, definitely. That's so cool that you get to experience all this stuff a little bit earlier than, most pre-med students would. So that's
Yeah,
great.
absolutely. Definitely sets us apart, because it's such a grueling and competitive process. Everybody, thinks that they want to be a doctor. And so everyone's going to do the best that they can to put themselves above other, in front of other people, make themselves stand out. And I think that this is definitely one of those things.
Yeah, definitely. Well, that's all the questions I have for you today, but thank you so much, Hallie, for joining
Yeah,
me today and
absolutely.
explaining what a medical scribe does and your experiences. It's greatly appreciated.
Thank you for having me.
Of course.